I want us to spend a little bit of time talking about medical education just because it really has garnered a lot of interest, especially recently, and it really deserves a lot of our attention. Now, when we think about when medical training begins for physicians, it begins most clearly at the start of medical school. And when we think about medical school, there's an analogy that people love to use. They say that, learning in medical school is like trying to drink out of a fire hydrant because there's just so much information coming at you and you're just trying to take it all in at once. And this is a good analogy because that is exactly what it feels like. However, I do not think that this analogy is the right approach to medical school. I think, just as is the case in real life, that trying to drink from a fire hydrant is very foolish. I think the same goes for something like medical school, where it's not really an effective strategy to try to just take everything in at once and cram as much as you can into your brain. And I think there's a lot of truth to what I'm saying, not only because I'm saying it, but because if you ask a lot of people that have gone through the process, they really don't retain a lot of the information. And a lot of those preclinical years where you're just trying to cram in all this information into your brain seems to be largely wasted. So the analogy that I prefer is that medical school, especially in the beginning, is like trying to find a drink at a water treatment facility. The bulk of the water that you're going to be exposed to is contaminated in the sense that it's not worth drinking. You have to be very deliberate and intentional with what information you try to take in. And really, you don't have to learn everything at the same time. And it really would do everyone a lot of good if actually you didn't try to learn everything at once. Instead, if you take a systematic approach, you can go further and actually drink something that's not going to make you sick. So, really, when we think about medical training, what I'm trying to really highlight here with these analogies is that when you find yourself in a medical situation, there is going to be loads of information that you're going to be exposed to at once. And that's just the nature of the beast because, spoiler alert, everything is related to health. Everything arguably can be traced back to a person's health and well-being, and as physicians and medical professionals, that is what we're trying to preserve, the health and well-being of our patients. So it's all relevant. But in reality, we only have a limited amount of time. You only have a limited amount of time to study, to learn, to talk to patients, to order labs, to do tests, to do operations. So we have to prioritize. There's just no way around it. There is X amount of time, and in order to get the best use out of it, we don't try to just cover everything that might be important. But instead, we should make sure that everything we do cover and learn is important. That way, when we think about the amount of time that we have, we fill it up with all quality information. In the case of medical training, when you get to your medical program, if you focus on learning everything that matters versus trying to learn everything that might matter, then by definition, you will have used your time more efficiently. Now, obviously, there are trade-offs. Not everything that is important is clear, but in talking about this more, maybe in future videos, we can kind of discuss how we can shift the medical education system to make those who are in charge a little bit better capable in making sure that they kind of filter that information out for their trainees. But fundamentally, don't view it as trying to drink from a fire hydrant when you get to your medical training or now that you're in it, because that's just very, very foolish. Instead, I hope you can shift your approach a little bit and think about the fact that you are serving as a filter for yourself. You have to be very diligent and intentional in making sure that you learn the information that is actually important so you don't crowd out the important details in the future.